Well, anyone that's made a trip to the pharmacy knows that there's often a one-size-fits-all approach to dispensing medicine, but there's some new advances and technologies that are changing the landscape of prescription medicine. I'm joined today by Kelly Nolan, pharmacist and clinic owner. Kelly, today we're going to talk about compounding medication, really, which is probably unfamiliar for a lot of people. Fill us in on sort of what the difference is from going to the pharmacy to having your medication tailored for you.
Well, that's exactly what it is. It's customized prescription. So we recognize in medicine that one size does not fit all, and everybody's an individual, and we want to minimize side effects. So that's why we do a lot of topical applications.
Now, what are some people, I know a lot of people have certain allergies. What are some of the reasons for people having their medication sort of custom designed?
Well, there's a number of reasons. One is dosage form, so site of application, ease of application, less side effects, so anything that doesn't go through the gut area. Just even dosage. I mean,
well,
what if the dosage is not appropriate for you, then what do you do?
It always strikes me as very strange when when I've taken medication that the same dosage applies for a 12-year-old as it does to a 200-pound man. That always seemed really odd to me.
It doesn't work too well that way.
Absolutely.
Yeah.
So let's talk about some of the areas where you're seeing people are really leaning towards getting this medication. A lot for pain management, but there's other avenues as well.
Well, our main target initially was working with bioidentical women, bioidentical hormones for women. That was our main target, and we've started to branch out into other areas, and pain management definitely is very optimal.
Okay, now this is certainly something that isn't offered at a lot of places, and it involves doing your homework. I know a clinic like yourself, but you need to be very cautious sort of and do your homework really when getting this done.
But I think the challenge is just getting word out to doctors and patients that these services are available. So more women know now about hormone therapies,
right?
But the pain management is a different area again.
Okay.
So picture every drug that you get in tablet form almost can be available in a powder that you can incorporate into a cream or gel.
Wow, that's pretty phenomenal.
So the side effects just drop right down.
Wow. So what kind of assessments are you making when somebody comes in looking to get their medication compounded? You're taking into account their weight, what are some of the other factors that you look at?
It's pretty basic. It's looking at them as an individual. What's their health profile? What's their assessment? What's their history? What have they used in the past? What have they been successful with? And how we can improve that for them.
And I imagine that's something that evolves too
with
a patient's health, that you're constantly reevaluating that.
Absolutely.
Wonderful. Well, thank you for shedding a little light into this compounding medication, and we certainly encourage people to visit the Real Life website to find out more about compounding medication and a little bit more about Kelly Nolan's clinic.